Ready? All right. Welcome to dissection of the pig heart. This one is a little bit larger than a human, but what I want to show you right here is the base of the heart, which is where all of these large vessels are coming off of the heart. That's referred to as the base. The apex of the heart is the pointy part, or the more inferior part of the heart. Also, you'll notice on the surface of the heart, both on the front and the back of the heart, you'll see lots of blood vessels here. These are to supply the heart muscle itself with oxygenated blood. It has to have oxygen also. Now, you're looking at the anterior portion of the heart now, and this little groove where the blood vessels flow down, that's called the anterior sulcus. And on the back side, we also have a sulcus that those blood vessels fit into. The largest of the sulci on the heart come right around the top, right around this direction right here. And when the large coronary arteries come off of the aorta, they follow this sulcus around all the way to the back side of the heart and send these branches down to supply heart muscle with oxygen. And that is where, when you talk about an MI, someone having an MI, it's these blood vessels that get blocked with a small clot, not these large vessels at the base of the heart. Okay, what I want to do now is show you the exterior part of the auricles. These are part of the atria, and they look like little flappy dog ears right here. They allow for additional blood flow, additional space within the atria, the top chambers of the heart. What I want to show you now is I want to open these things up. Okay. And remember, this is the front of the heart, so we're going to open it up like a book. And we can see the left ventricle here, and of course its matching part over here as we fold it like a book. Within the left ventricle, it's very obvious. You can see the chordae tendineae. These are the heartstrings. These attach to the cusp of the heart valves that are called atrioventricular valves. The one on the left side is called the bicuspid or mitral valve. The one over here on the right side, as I open up the right ventricle, is the tricuspid valve. And you'll see it also has these small chordae tendineae associated with it. These things are very strong. You'll see that I can take and put my probe under there and lift the entire heart. They're very, very, very strong. They're the anchors for the cusp of those valves to keep them from what they call prolapsing and allowing blood to go in the wrong direction. Now, the top chambers of the heart, we looked at the left ventricle. The top chambers of the heart are these structures here. I've got one cut open here, and they are called atria. They are the receiving chambers of the heart. They receive blood from every part of the body. Okay, the right side will receive blood from every part of the body except the lungs. The left atrium will receive blood returning from the lungs. Blood will enter here, pass through the valves. In this case, it's the bicuspid valve, and then enter the left ventricle. When the heart beats again, the blood will exit the left ventricle and come up through the aortic valve. Right here where the probe is, this little flap of tissue right here is the aortic valve, and exit via this large aorta, see the very thick walled artery, and go to the remainder of the body. And that's part of the systemic circuit. Okay, now when you look inside the heart chambers, you might think, well, I expect them to be very smooth. They're not. You see, they're very lumpy. This is muscular tissue, and down in the ventricles, that lumpy muscular tissue is called trabeculae carneae muscle. The muscle specifically where the chordae tendineae attach are called papillary muscles. And then their other attachment, like we said, is up here at the cusp of the valves. Now, if you look inside the atria that we did a while ago, you're going to see there's a lot of rough muscle tissue here also. That's called pectinate muscle. And that allows for the smooth contraction of the different chambers of the heart. Okay, I I think that probably concludes most of what we want to see. I'm going to flip this one over and show you one more cut that I made to be able to show you the pulmonary valve. This is the large pulmonary trunk on the anterior surface of the heart. And when I make an incision right here, I can reach down in there and pull up this tissue, and that is part of the, that is part of the pulmonary valve. You have to make a little different incision to see that. So what you need to learn is, how to identify the heart, the anterior portion and the posterior portion, and then you're pretty well oriented when with the dissection of the heart at that point.